I would like to, I was executive director of the Urban Health and Wellbeing program, which is a program of the International Science Council, hosted by the Chinese Academy of Science Institute of Urban Environment in Xiamen in China, until 2022, until recently. And then I stopped and moved to the United Nations Institute in Macau, where I still am now. And now I am reflecting back on 8 years of the Urban Health and Wellbeing program, and maybe together with your support, look a little bit into the future, how it could look into the future, because we want to continue that project with other people, with new people. And we are at the moment thinking about how that could look like. And I'm happy to involve you all in that thinking progress. So we published a lot of stuff. I will not go into detail into every of these publications. Just that you have a brief impression and are impressed of all the publications we produced during that time. And let me go straight away to the kind of thinking we started off with at the Urban Health and Wellbeing program. So we started the program. You have to imagine it's a program, not a project, of the International Science Council, and these programs have scientific committees, and the scientific committees are interdisciplinary. They come from different fields, from the health science, public health, global health, geography, and others, very interdisciplinary. And what brought us together is a systems thinking. What we said is systems thinking. And everybody has slightly different ideas of what systems are and how systems thinking should look like, and how scientific methods in systems thinking should look like. So we spent a lot of time consulting and talking about that, which was very interesting, exciting, of course. But looking back now, I want to say that in the very beginning, it costed also a lot of time, and we didn't come to. It was not conclusive, this thinking. But we started off with this kind of thinking, and this diagram. It was actually our conceptual diagram, which is based on a health conceptualization of diagram. And we thought of urban health as problems being complex, but mainly because we saw urban health as an aggregation of different determinants of health, which were interconnected. And this is what the diagram also tries to show. Today, I would say that urban health problems are less deterministic, actually, and rather actual problems of complexity, understood as in complex systems science, not as colloquially understood as complex, which usually means actually not complex, but complicated. And the difference is that complex problems are often misunderstood as being complicated problems. And that means they are essentially solvable, and complex problems are essentially not solvable. Problems of complexity, as understood, for example, by Jane Jacobs, who's an important person in the urban science, and in complex system science, can only be understood to some degree, but not solved, for example, by applying the scientific method. And why is that the case? Because complexity has inherent irreducible uncertainties, and because further complexity is also required to solve complex problems, which creates ever more problems of complexity. And therefore, the kind of problem which cities are also the kind of problem what urban health is, problems in handling organized complexity. We never came to that kind of understanding in the program, even after 8 years, because everybody had a different idea and understanding of what complexity is and what systems are and what systems thinking is. Now, like I said, the program had a multidisciplinary scientific committee, and this committee determined the direction of the program, not the director. but the committee. And even though all agreed to apply systems thinking, the ontological and epistemological traditions from which each came were so different that we really struggled to come to produce some kind of collective intelligence. This diagram I'm showing here is by Aaltonen and Sanders, and it illustrates how the understanding of complexity defines the research methods which are applied. If our mental models of complexity think in terms of rules and removing ambiguity and also standing outside of the system which we try to understand, which we try to manipulate or control, so that in order to improve it, of course, we are more in the bottom left part of this diagram, which is defined by design and rules. And the other extreme is when we perceive ourselves as part of the system which we are trying to understand, that allows ambiguity, where we apply more heuristics, and then we are in the field of social complexity. And you can see systems thinking actually in the bottom right area of this diagram. The methods, the actual methods which we applied, this is an example of once it was called the Fester sensitivity analysis, which we also applied a lot here at CEF. Now it's called collaborative systems modeling and has other different names, but it continues to be very popular. It was somewhere in between, in the middle of that conceptual diagram I just showed. Now, as mentioned, when we started the Urban Health and Wellbeing program by taking a systems approach, we had very different views, and the human-centered systems approach recognized that the city is a complex system, that the urban environments change, that cities provide multiple goods and services, and that lifestyles in cities change, and all impact on the health and well-being of people living in cities. So the focus was less on the health, in parentheses, of the urban environment, simply because health was a term mainly attributed to humans and not to cities. And this led to a very anthropocentric mental model of urban health, which recognizes that all aspects are somehow interconnected, that all these different determinants, and interrelated and affect each other, but less focus on understanding the urban metabolism of a city and its effect on planetary health. The people in the middle of this diagram, which is by diagram, by the way, they are symbolic for the fact that most of the time people think of the health of people in cities when they think of urban health, and not of the health of cities. And I think it's very important to make this difference. So the problem with that is that people in cities can be healthy, and cities can be thriving and growing, while the surrounding planetary health is degrading. And due to the global interconnected urban lifestyles and lifelines with its flows of resources and information, it takes time for cities to get the message that their urban health and well-being is coming at the cost of planetary health. But this is changing today. Now, so there was a different understanding of the idea of first of systems and systems thinking, but then also there were different ideas of what health actually is. Looking back, I realized that we were trying to maneuver this program actually without a clear or a common definition of what health is. Mostly it was understood as opposite of disease and illness, also of people. So a condition that allows an individual to cope with the demands of daily life. Or it was understood like the World Health Organization defines health as a state of complete physical and mental social well-being, and not only the absence of disease, like the first kind of decision. But then sometime I discovered this third definition, which I will refer to as the salutogenic definition of health, which is a state of balance or equilibrium between an individual and its environment. And I try to apply that kind of understanding of health and that definition of health to urban health, to the city. And if we do that, we could work with this kind of definition of urban health, that is the health of cities and its people, and the complex state of the urban environments on which it depends. And some of you might see the resemblance to the definition of planetary health, which is not a coincidence. Now, that anthropocentric view actually creates an oxymoron, I think, which is also characteristic for sustainable development and might be also the reason for our difficulties in achieving the sustainable development goals. You all know that we're not doing very well in achieving those goals. In the past, we have improved health and well-being also by more and better cities and possibilities for people to live in cities. But all that has come at a cost which we largely marginalized, externalized to people and the environment, and in the past for which we did not pay the bill. Now we want to improve the lives of a growing urban population and at the same time reduce the urban ecological footprint by decoupling growth from resource use. And that seems to be a dilemma, obviously. Or is it, and this is a question, is simply impossible. Now we know from the new urban sciences, and I think also looking back that if we want to move forward with this kind of program, we need to learn more from the urban sciences as much, at least, as from the health sciences as we did in the past. That to sustain open-ended growth in the light of resource limitation requires continuous cycles of paradigm-shifting innovations. These diagrams are from the book of Geoffrey West called Scale, where they try to understand the scaling effects in cities. And these cycles of innovation do not only happen more often, they also have to occur in shorter frequencies in order to continue on a growth trajectory. This kind of growth, and this is a citation, and our growth behavior is unsustainable because it requires an unlimited, ever-increasing, and eventually infinite supply of energy and resources at some finite time scale in the future in order to maintain growth. That just sounds just like a rehash of the Malthusian argument. Of course, you will recognize that. That has been frequently dismissed by many generations of economists because it has never been proven true. Malthus said that with increasing populations, we won't be able to keep up with demand for food and open-ended growth, and that will eventually lead to some kind of collapse. But it never really happened, or not at the scale which was maybe predicted. So therefore, it seems that the limits to growth reports from 1972 and from 2004, the new book, the update, which were often dismissed, especially when breakthrough innovation promised another round of growth, might be not so wrong after all, and that Malthus' theory of a collapse might just be postponed, like Jeffrey Sachs says in this interesting article. And although complex systems collapse happens constantly in nature and is an important part of a renewal cycle, what we knew in ecology, of course, it is seldomly seen in that way in systems that include people. I don't know why. I assume because people are afraid of collapse. And most often, efforts are made to avoid collapse or postpone collapse for the well-being and for the benefit of people. One way of doing this, postponing or avoiding, is trying to decouple economic activity or economic growth from resource use and from its environmental impact by increasing efficiency. And that's what is done under the terminology of decoupling. It's a UN Environment Program supported initiative under the term of decoupling. Increasing efficiency is an attempt to achieve more for more people with less resources. And it effectively postpones collapse, but it cannot avoid it. Decoupling is put into practice by building, for example, compact cities. Compact cities are very much promoted because they are more efficient, energy efficient, resource efficient, by promoting green growth and the bioeconomy activities, and also, of course, by digitalization. Those are all necessary if we do not fundamentally change the values and institutions of an existing development paradigm, which I think we don't, which is all built on continuous growth. And urban growth does not mean it is healthy, even though many people in cities have lived better lives. So there are numerous health problems in cities which are on the cost side of an inclusive accounting system, even though compact cities are more energy efficient. And there's another effect of the efficiency effect, which are very well known by economists and others, I guess, which are sometimes referred to the Jevons paradox, is that increasing resource efficiency drives down the costs of production and thereby increases consumption. So just the opposite happens actually at the total. People use more rather than less. Okay, I think this is quite well known. So back to our program, although we were all committed to taking a systems approach, there were different perceptions of what a system is and how to take a systems approach. On one side, there was the more engineering and management approach to systems and also to complexity, which believes that problems of complexity can principally be solved and that we just need more and better data and bigger models, especially. And these approaches could be characterized as attempts to fix problems. Problems need to be solved or fixed, like engineers do. The engineers are wonderful people, don't get me wrong, but it's just the kind of thinking. And on the other side, there's the complex living systems idea, which saw the value of data and models as well. We worked with models ourselves, but also understood that problems of organized complexity cannot be solved like solving a mathematical equation for X. The approach is more process-oriented and is more about people and their societal institutions. So it's more like the process is more important than the result, actually. And that was very much often the insight of the methods which we applied. Okay, now let me come to background and some possible futures. As you know, you will all know Herman Daly. He just died one year ago in October 22. I think he influenced the thinking of many of us, so I wanted to mention him. One of his first academic articles was published in 1968, and it was entitled on the economics as life science. So economics as life science. And there he made a powerful analogy between biological organisms and economic systems. And both rely on flows of matter and energy, and both produce complexity and flows of degraded waste. Daly argued that economics treated growth as an end rather as a means to an end, a higher purpose of life, higher than that of just production and consumption. And he explained that there is an economic limit between which further growth becomes a disutility. And that limit could be the border between two worlds, which we are talking about today, again, under different headings. He referred to that as the empty and the full world, which is relatively empty or full of people and the stuff they produce and consume, and relatively full or empty of nature and its resources. The same idea was picked up by Professor Rockström and his colleagues. They just called it differently. They called it from a small world on a large planet to a large world on a small planet, but basically it describes exactly the same thing. Okay, this idea is so popular, seemingly, and easy to understand, that on a big world and a small planet, they started to define boundaries. Yeah, so within these so-called Earth system boundaries, we are safe, and outside, we put our survival at risk because we degrade essential ecological life support systems. This is in the big world, small planet scenario. or the full world scenario. And the same idea was picked up by this lady, Kate Raworth, who argues accordingly that economics needs to not to grow, but to thrive within limits which define the donut. And she called that donut economics. I'm sure you've heard of her. I want to spend a few thoughts on that because they're so popular at the moment. So cities are also picking up on this intuitive approach and start thinking about solutions in the donut space, you know, the space where the donut is, not in the center and not outside, but in between. So while this is a good thing to do, it doesn't ask what enables them to start thinking in donuts. I'll just call it like that. So in order to try to avoid the terminology of sustainability. They are relatively wealthy, these cities who think like that. They are complex societies. They are complex societies with high problem-solving capabilities. And that is also costly in terms of time, in terms of organization and energy. That means they have high levels of socio-political complexity. They are already, I will show you a complexity trajectory later on a quite high level of complexity. Not all societies can afford to do that because they need to grow first and provide the basic needs, which is accepted by this approach. But there are some questions we still haven't answered, even though we've done so much research on poverty. How do we know that the sum of the developing countries who want to come into the donut, you know, from the not enough to into the donut area, become into the donut would not exceed the ecological ceiling? We don't know that. What does it mean for one city to live within the boundaries of the planet? The question cannot be answered because it's related to ethical and value considerations across different cultures and geography. Also, the question of how the shortfall boundaries, that means the inner boundaries of the donut, how they are defined, is still open. Who are the poor and what is poverty? Questions we've been asking for centuries. They all remain unanswered. And whether 8 or 9 billion people on the planet basics needs will be met within the ecological ceilings also remains unanswered. So the ecological ceiling is not an absolute unchangeable boundary. We know from conservation and use of biodiversity projects that this is not an either nature or people question. Another thought is that the donut economy replaces growth with thriving. And I really tried hard to understand what thriving means scientifically, I mean, because I think it's just a replacement of growth. It overlooks that in order to thrive and to build a regenerative economy, you also need to build up complexity, which requires energy and which has an environmental impact. So these are just some thoughts on the donut economy. How did our thinking actually started to shift? And actually, it was COVID that started shifting our thinking. If I go back to our program and to the question of how the shift in thinking came about, it was that we started off from complexity as this idea of complicatedness. I think I've repeated that several times now, to the idea that we just need to recognize the process as a learning process more than a problem which needs to be solved. And the achievements in the process of learning are achievements rather than trying to solve problems forever, collecting more and more data forever. And we can improve that process by developing agency. Looking into the future, that's an important area by deliberative democracy, not just democracy, but deliberative democracy, self-governance, just to mention some examples. This is the trajectory I mentioned before, the complexity trajectory. I think in future, we need to try to understand, and it goes back, by the way, to a book written by Joseph Tainter, which is entitled The Collapse of Complex Societies. And if we understand cities as complex systems, we need and try to understand the status of their condition, their health condition. We need to somehow try to determine the position and the condition of cities on that complexity trajectory by various indicators, which we need to select because there are so many different ways to measure complexity. Okay, and this diagram just shows, so, and you can see the black the black two straight lines. They basically show again what Herman Daly said about when we have economic growth and uneconomic growth combined with the complexity trajectory. The tipping point, or the point where it goes to the uneconomic growth, could be the point where we need to radically change instead of innovating, but principally doing the same thing by trying to improve efficiency. So the dotted line, which goes further up, is another round of growth triggered by innovation. But it's basically the same kind of growth, just faster, better, and more efficient. And the dotted line, which goes a little bit flatter, is the suggestion by some economists to use less, not to continue growth, but green, but to degrow. It's an interesting idea, which I just wanted to mention here. In a way, it's a little bit like the call for flattening the curve, which we also heard during the COVID, just to decelerate instead of accelerating these processes of development and growth. Now, two different ways of thinking about why societies have collapsed are, you probably know, represented by Jared Diamond and Joseph Tainter. I mentioned Joseph Tainter. One focuses on the environmental change and the other focuses on the socio-political change, and probably both work together and lead to either scenarios of adaptation or collapse. My understanding of the politics of uncertainty is interesting in the context of complexity science. And my understanding of Ian Schoons, who wrote this books of Politics of Uncertainty, is that after recognizing that uncertainty is an inherent property of complex systems, we should not fear it or spread fear in order to then propose the problem-solving thinking about complexity and apply fear-based control and command strategies, rather to promote creativity and what he calls conviviality. And that is also the aim of deliberative democracy. Why is deliberative democracy so important in this context? I think in a nutshell, it is about giving people the possibility of an informed choice, not just a choice. So informed is all about deliberation, and choice is about democracy. Why is that important? Because I think it's in times of increasing complexity, global complexity, where also information and interconnectivity increases, the ways in which information is connected to each other and narratives are spread, for example, to create alternative truths. It's really important. So in this situation of information complexity, let's say, it's increasingly difficult to make well-informed choices. You can't just say, well, we have a democratic system, let's let people choose, but people are also more confused. So it doesn't work as well anymore as before. So that's why another reason why you need the deliberation part more than ever before. So deliberation addresses that situation and aims at ways to shape information into knowledge. And that's, I think, is important. The path of ever-increasing efficiency, speed, innovation, and growth, facilitated by driven by digitalization, is only one choice. And another one is to slow down, like I just suggested. This is the so-called learning wheel or data knowledge action wheel. This is what we need to achieve in the deliberative approach. The change data into action, into knowledge, and back into data, which is basically a learning, and integrate that into our way of doing governance. Now, what can cities do for urban health? I realize I need to speed up a little bit. If we want cities to be healthy, we need to understand what keeps them agile, I will say. And for that, we need data. I will argue that what we need to we need to combine data on the urban metabolism with data about urban and planetary health in order to get more complete picture of this so-called salutogenic balance between people, cities, and the planet. So it's a kind of triple salutogenic health balancing act, which is the real challenge here, by which we need to address. What can cities do? Firstly, they can make sure that to collect the data which are fit for purpose. What's the purpose? The purpose here is to understand and measure the triple balancing act I just mentioned and remain within the safe operating space in the city and the planet as well. These are data for urban health, which help understand and in which metabolic condition the city is, but also how it is performing, how the city is performing, and at the same time, its impact on the planet and the environment. As I mentioned earlier, people can live healthy lives in thriving urban environments, and yet they can be living at the expense of the planet. And then we have the same problem as before. So the purpose in data fit for purpose is to identify the tilt of that scale in this diagram, which measures the triple salutogenic challenge. If we are setting planetary boundaries, it is just logical that those boundaries translate down to the urban boundaries and to community boundaries. And if we are living in a full world, urban growth boundaries are needed to protect the environment from the city, while before, in an empty world, like with city walls, the city protected itself from the environment. It was just the other way around. Many things are just the other way around when we move from the empty to the full world, which I think is really interesting. So I believe that the donut economic attempts to translate planetary boundaries to the urban system boundaries, and I think that's a good thing to do. We already have urban growth boundaries in many countries. They already exist to prevent urban sprawl, for example. But today, urban boundaries also need to be defined by multilateral environmental agreements at the planetary level. And for that, we need urban health data that are fit for purpose, what I mentioned previously. And those new urban system boundaries do not need to be walls or fences, but institutions like the Paris Agreement that translate down to the city. And it's no easy task to define these boundaries. And even if we achieve to do so, we need to find a distribution mechanism, not only within cities, but also among cities that overshoot and those that fall short. So it's not an easy task. This is my last slide. So when we better understand the urban health problems we are facing in cities as problems of complexity, the solutions are further increase in complexity, big data, digitalization, innovation, efficiency, and control. That's one point. But also simplification. We should also think of simplification. That means degrowth and decentralization, for example. I also want to start talking about collapse because I think it shouldn't always be avoided. As I said in the very beginning, it's a very natural renewal process of ecological systems, and we're part of the ecosystem. So why don't we think about the benefits of a collapse at appropriate scale, I would say. So the price of energy largely defines these choices, I think, especially between 1 and 2. If we have cheap energy, further complexity will increase. And expensive energy might lead us more to the simplification strategies. conflict and complex can also be avoided if we learn from the past and from each other. So collective, try again, collective learning. Thanks a lot for your attention.